Once the patient is in the department, verify name, date of birth, and that the orders are correct. If the patient is a female, ask if there is any chance of pregnancy. If all is correct and there is no chance of pregnancy, instruct the patient to put on the gown and remove any artifacts that might be in the way. When the patient is done changing and ready to begin, you're going to thoroughly explain what you need from them. Allow the patient to talk about any comments or concerns that they may have. When the patient is ready, shield and begin positioning.
For an AP external projection of the shoulder, non-trauma, the SID is 40, the IR is 10 by 12, the KV is 75 to 85, and there is a grid. Place the patient in a true AP erect or supine position. Center the patient's scapulohumeral joint to the center of the IR. Abduct the patient's arm slightly, externally rotating arm until epicondyles are parallel to the IR. The CR is perpendicular to 1 inch inferior to coracoid process. Collimate 4 sides and suspend respiration during exposure. The anatomy demonstrated for an external projection of the shoulder is the proximal humerus and lateral 2/3 of the clavicle and upper scapula. The greater tubercle is visualized in full profile on the lateral aspect of the proximal humerus. The lesser tubercle is superimposed over the humeral head. For an AP internal projection, everything will be the same as the external, except the patient's hand will now be pronated and arm will be internally rotated. Epicondyles will be perpendicular to the IR. The anatomy demonstrated for an internal projection of the shoulder will be the same as the external projection, except the internal rotation is evident when the lesser tubercle is visualized in full profile.
For a scapular-wide lateral trauma projection of the shoulder, the SID is 40, IR size is 10 by 12, the KV is 75 to 85, and there is a grid. Depending on the patient's condition, instruct patient into an erect or recumbent position. Rotate patient into an anterior oblique position as for a lateral scapula. Patient will be facing the IR. Palpate the superior angle of the scapula and AC joint articulation. Rotate the patient until the imaginary line between those 2 points is perpendicular to the IR. Depending on the patient's body type, the amount of obliquity may range from 45 to 60 degrees. Center scapulohumeral joint to the CR and center of IR. Abduct arms slightly if possible, so that there is no superimposition of the proximal humerus over the ribs. The CR is perpendicular, directed to the scapulohumeral joint. Collimate 4 sides and suspend respiration during exposure. The anatomy demonstrated for a scapular Y view is a true lateral view of the scapula, proximal humerus, and a scapulohumeral joint. The thin body of the scapula should be seen on end without any rib superimposition. The acromion and coracoid process should appear as the upper ends of the Y. The humeral head should appear superimposed over the base of the Y if the humerus is not dislocated.